So let's begin our examination of the anatomy of the shoulder complex. We'll start by examining the bony anatomy of this region. As I said before, the shoulder complex is composed of three bones: the clavicle, the scapula, and the humerus. The clavicle also articulates with the sternum, so we'll consider this bone as well. Since the clavicle and the sternum are the proximal attachment of the upper extremity to the axial skeleton, we'll begin first with examining the clavicle and its attachment location with the sternum. So let's take a good look at the sternum and the clavicle and how they relate to one another. So first off, we can see the sternum very clearly in the top two pictures on this slide. The picture on the left shows just the sternum. The picture on the right shows the whole rib cage, including the sternum and the clavicular attachment to the sternum. So let's take a look first at the sternum and its main parts. The sternum will also cover in our examination of the rib cage, but again, the sternum is going to be this whole bone that sits down the center of the rib cage, also known as the breastbone. Most importantly for the shoulder complex, though, is the top portion of the sternum, which is the manubrium, this whole portion here. The middle portion, the larger portion, is called the body, and then we don't see it in this picture. We can see it over here. The very distal end, or lower end, inferior end, is called the xiphoid process. But what we're concerned with here is the manubrium, which is the top portion. The manubrium, the top portion of the sternum, has a couple different notches that we need to know. It basically has a notch over here, has a notch over here, and then a notch up top. Well, both on the left and the right side of the sternum is notches that are going to basically connect to the clavicle. So they're called the clavicular notches. So there's a left clavicular notch and a right clavicular notch in the manubrium. So it's a landmark on the sternum that's going to articulate with the clavicle itself. In between those two notches is the jugular notch. It's named that because the jugular veins pass behind that notch. So it's just a landmark that's useful. Now, the rest of the sternum really doesn't play a part with the shoulder complex, so we'll cover that in a different presentation. But again, it's the manubrium and those clavicular notches that are going to be important here when we examine the sternoclavicular joint. Now, the clavicle is considered to be a long bone. Obviously, it's not super long; it's fairly short, but it's again a bone because of its shape. It's called a long bone. And we can see that from the front or the anterior view, it looks relatively straight or flat. When we look at it from above, which is what we're seeing in these bottom pictures, we can see that it has a bend to it, makes it kind of S shape. So it does bend outward here at the beginning and then backward at the distal aspect. So again, starts to bend outward and then inward. And you can feel that on yourself very readily. You can palpate the clavicle very easily, although it's a little sensitive because there's a lot of nerves in that area. So we can see that basically the shape is an S-shaped from above, and so on. There are really only three main landmarks that I think are relevant for this aspect of the presentation. And that's going to be the ends of the clavicle, and then obviously the middle portion is called the shaft. So the middle portion is called the shaft of the clavicle. The proximal end that articulates with the sternum is called the sternal end of the clavicle. The distal end of the sternum, of the clavicle articulates with the scapula and is called the acromial end. So again, we have the acromial end and the sternal end. If you're given a clavicle and you're asked to identify which is the medial aspect, which is the lateral aspect, the medial aspect is going to be rounder, especially if you were to look at it from this angle. You'll see that it is rounder than the distal aspect of the clavicle, which is flatter. So again, that's how you kind of can tell those landmarks. Now, this bottom picture shows the inferior view of the clavicle. There are a couple other landmarks. We'll talk about it when we talk about the joints, but there's some roughened areas that we find on the clavicle down here. They're going to be attachment sites for ligaments that hold the clavicle to the scapula and support the acromioclavicular joint, which we will talk about later. Now, the clavicle, for the most part, is not that important functionally. I mean that in that, clinically we don't see a lot of necessarily injuries to this region. It doesn't move a whole lot when we look at the whole function of the shoulder complex when we compare it to the glenohumeral joint. But what really makes it important is it's the bone that connects the upper extremity to the axial skeleton. So basically, our upper extremity is only directly connected to the axial skeleton here at the sternoclavicular joint. So it's a very important bone in that it transmits a lot of force from the upper extremity to the axial skeleton. So when we're doing push-ups or if we fall on an outstretched hand, a lot of that force is transmitted through the clavicle. And that's where the clavicle becomes a little bit more clinically relevant. It is fractured fairly frequently. One study I read estimated that approximately 5% of fractures in adults are fractures of the clavicle, and that's because often it's the weak link. If we fall on an outstretched hand, that's the bone that often breaks from that type of a landing. Or if we land on the tip of our shoulder, we can often fracture the clavicle as well. Luckily, the clavicle fractures it fractures frequently, but luckily it heals very well. Often the fractures are non-displaced and can heal without any surgery or any kind of internal fixation. Anyway, that's the anatomy of the clavicle and the sternum.